10 Early Signs of Lupus You Should Never Ignore. Hey everyone, welcome to the channel. Today, we're talking about something crucial: your health. Lupus affects over 5 million people worldwide, often going undiagnosed for years. It's an autoimmune disease known as the Great Imitator, because its symptoms mimic other conditions like fibromyalgia and rheumatoid arthritis. In this video, we'll cover 10 early warning signs of lupus you should never ignore. These signs might seem minor, but catching them early can lead to quicker diagnosis and better outcomes. Women are 9 times more likely to develop lupus than men, with most diagnoses occurring between ages 15 and 45. African American, Hispanic, Asian, and Native American women face higher risks than Caucasian women. These demographic patterns help doctors understand who might be more susceptible, but lupus can affect anyone regardless of age, gender, or ethnicity. Lupus symptoms can be mild or severe, gradual or sudden. That's why paying attention to your body is so important. Early treatment can help prevent serious complications and improve your quality of life. If this helps you or someone you know, please like and subscribe. Now, let's dive into sign number 1. Disclaimer: this video is for educational purposes only. It is not medical advice. Please consult a doctor or call emergency services if needed. All information presented has been thoroughly researched and verified. You can find source links in the video description. 1. Persistent and extreme fatigue. The first early sign of lupus we need to discuss is persistent and extreme fatigue that goes far beyond normal tiredness. This isn't the fatigue you feel after a long day at work or a poor night's sleep. Lupus fatigue is overwhelming, debilitating exhaustion that doesn't improve with rest and can make even simple daily tasks feel impossible. Normal fatigue typically resolves with adequate sleep, rest, or addressing underlying causes like stress or overwork. Lupus fatigue, however, persists despite getting plenty of sleep and can actually worsen with physical activity. Many people describe it as feeling like their energy has been completely drained, as if they're moving through thick mud or carrying invisible weights. Lupus fatigue often comes in waves and can hit without warning. You may wake up feeling okay, then feel completely drained by mid-morning for no clear reason. This unpredictability can be frustrating and seriously affect your work, relationships, and daily life. Lupus-related fatigue comes from chronic inflammation in the body. As the immune system attacks healthy tissues, it uses up a lot of energy. This constant internal battle drains your energy, leading to the deep, ongoing exhaustion many lupus patients feel, even after rest. Lupus can seriously impact sleep, even if you think you're getting enough rest. Pain, discomfort, and other symptoms often disrupt deep sleep, leading to poor sleep quality. This worsens fatigue, creating a tough cycle that's hard to break without proper treatment. Many people mistake lupus fatigue for stress, depression, or being out of shape. But lupus fatigue is different. It doesn't improve with rest, caffeine, or exercise like normal tiredness. It's deep, persistent, and often feels overwhelming, even after a full night's sleep. If you're constantly exhausted, even with rest or lifestyle changes, talk to your doctor. Track your fatigue, when it happens, what makes it worse, and how long it lasts, to help identify the cause. Fatigue is one of the most common early signs of lupus, affecting up to 90% of patients. If you're constantly exhausted, don't ignore it. Your doctor can run blood tests to check for inflammation and autoantibodies linked to lupus or other autoimmune conditions. Early detection can lead to better treatment, helping you manage symptoms and regain energy. 2. Joint pain and swelling. Joint pain and swelling represent one of the most common early signs of lupus, affecting approximately 90% of people with this condition. Unlike typical aches and pains from overuse or minor injuries, lupus-related joint problems tend to be persistent, symmetrical, and often accompanied by morning stiffness that can last for hours. Lupus joint pain usually affects several joints at once, commonly the hands, wrists, knees, and feet. What makes it stand out is its symmetrical pattern. If one wrist hurts, the other likely does too. This mirror-like pain helps doctors identify lupus over other conditions. Morning stiffness is a common lupus symptom. You may wake up with joints that feel stiff or frozen, needing time and gentle movement to loosen up. This stiffness can last from 30 minutes to several hours, making mornings tough for many lupus patients. Lupus joint pain and swelling are caused by inflammation in the tissue lining your joints. The immune system wrongly attacks this healthy tissue, leading to pain and swelling. While lupus usually doesn't cause permanent joint damage like rheumatoid arthritis, the discomfort can still be severe and impact daily life. Lupus joint pain often comes and goes in flares. During these episodes, you may feel intense pain, swelling, and stiffness that limit movement and daily tasks. Between flares, symptoms can ease or disappear, making diagnosis difficult. Lupus joint pain can be unpredictable and frustrating. One day you may feel fine, and the next, everyday tasks like opening jars or climbing stairs become painful and hard to do. This up and down pattern often causes people to ignore symptoms or delay seeing a doctor, but early attention is key. Pay close attention to patterns in your joint pain and swelling. Track which joints are affected, when symptoms worsen, and what triggers flare-ups, like stress, weather changes, or poor sleep. This info can help your doctor better understand your condition. If you're dealing with ongoing joint pain, especially in multiple joints on both sides of your body and with morning stiffness, don't ignore it. These could be early signs of lupus or another autoimmune disease. Getting checked early makes a big difference. Early diagnosis and treatment can greatly reduce joint pain and flares. Options include anti-inflammatories, disease-modifying drugs, and physical therapy. Starting treatment early helps preserve joint health and mobility. 3. The classic butterfly rash. The butterfly-shaped rash is perhaps the most recognizable and classic sign of lupus, appearing in approximately 30 to 60% of people with the condition. This distinctive facial rash gets its name from its shape, spreading across both cheeks and the bridge of the nose in a pattern that resembles a butterfly's wings. It's one of the most important visual clues that can lead to a lupus diagnosis. The butterfly rash typically appears as a red or pink discoloration that covers the cheeks and nose bridge while notably sparing the nasolabial folds, the creases that run from your nose to the corners of your mouth. This sparing pattern is actually a key diagnostic feature that helps doctors distinguish the lupus rash from other skin conditions like rosacea or eczema. The rash can look different for each person, ranging from a light pink flush to a raised, scaly, and tender area. It may feel warm and vary in texture from smooth to slightly raised. The butterfly rash is significant due to its link with sun exposure. Ultraviolet light often triggers or worsens it, making it more noticeable after being outdoors. In lupus patients, even brief sunlight can cause the rash to flare, highlighting the condition's strong photosensitivity. The butterfly rash isn't always caused by sun exposure. It can appear during lupus flares, even without sunlight. Stress, infections, medications, and other triggers may also cause or worsen this facial rash, highlighting the need to consider various factors beyond UV light in managing lupus symptoms. The butterfly rash in lupus appears during flare-ups and fades in remission. It often worsens with sun exposure and signals disease activity. Lasting days to months, it's a key diagnostic clue and shouldn't be ignored, especially since its pattern and photosensitivity differ from other facial rashes. If you have a persistent rash on your cheeks and nose that worsens with sun, take photos and see a doctor. Specialists like dermatologists or rheumatologists may run blood tests for lupus. Early diagnosis helps prevent severity. Use sun protection, including sunscreen and clothing, once the photosensitive rash appears. 4. Unexplained fever. Unexplained fever is a subtle but significant early warning sign of lupus that many people overlook or attribute to minor infections. These fevers typically range from 99 to 101 degrees Fahrenheit and can occur without any obvious cause like a cold, flu, or other infection. Unlike fevers from infections, lupus fevers often don't respond well to typical fever-reducing medications. Lupus-related fevers tend to follow certain patterns that distinguish them from infectious fevers. They're often low-grade, meaning they hover just above normal body temperature rather than reaching the high spikes typical of bacterial or viral infections. These fevers may come and go unpredictably, sometimes lasting for days or weeks before resolving on their own. The fever in lupus results from the chronic inflammation occurring throughout your body as your immune system attacks healthy tissues. This ongoing inflammatory process can cause your body's temperature regulation to become disrupted, leading to persistent low-grade fevers that seem to have no identifiable source. Lupus fevers are concerning because they're recurring and persistent. Low-grade fevers may appear without a clear cause and are often mistaken for minor illness. If they last several days or keep returning, especially with other lupus symptoms, they should be medically evaluated. Track unexplained fevers by noting timing, duration, peak, and symptoms. This can help your doctor spot signs of lupus or other autoimmune conditions, especially if fevers come with joint pain, fatigue, or rashes. If you have recurring low-grade fevers that don't improve with medication, see your doctor. Blood tests like CBC, ESR, CRP, and autoimmune markers can help find the cause, such as lupus or another condition. Early recognition of lupus-related fevers can lead to quicker diagnosis and treatment. Though they may seem minor, these fevers signal inflammation and shouldn't be ignored. Treating lupus properly can help reduce their frequency and severity. 5. Unusual hair loss. Hair loss in lupus can be one of the most emotionally distressing early symptoms, affecting both men and women in ways that go far beyond typical pattern baldness or age-related thinning. Lupus-related hair loss often presents in distinctive patterns that differ significantly from common causes of hair loss, making it an important diagnostic clue that shouldn't be overlooked. Lupus-related hair loss comes in two main types. One is diffuse thinning, where hair gradually becomes thinner across the scalp without bald spots, often mistaken for stress or hormone issues. The other is patchy hair loss, with clearly defined bald areas that may show redness, scaling, or scarring, prompting quicker medical attention. Lupus causes hair loss when inflammation damages hair follicles, disrupting the growth cycle. This can lead to thinning, shedding, or even permanent hair loss if scarring occurs. People often first notice extra hair in their brush, shower, or pillow, or that their hair feels thinner and styles differently. Lupus hair loss often affects the hairline, causing short, broken hairs around the forehead and temples, known as lupus hair. These hairs are brittle and break easily. Hair loss usually worsens during lupus flares, often alongside other symptoms like fatigue, joint pain, or rashes. If you're losing hair unusually, especially with scalp redness, scaling, or tenderness, see a doctor. A dermatologist or rheumatologist can check if it's linked to lupus or another autoimmune condition. Early lupus diagnosis and treatment can slow or stop hair loss and may even allow regrowth if follicles aren't permanently damaged. Proper care and sun protection can help preserve and possibly regrow hair in unaffected areas. 6. Sensitivity to sunlight. Photosensitivity, or extreme sensitivity to sunlight, affects approximately 60 to 70% of people with lupus and can be one of the earliest signs of the condition. This isn't simply preferring shade over sun or getting sunburned easily. Lupus photosensitivity involves severe reactions to UV light that can trigger rashes, worsen existing symptoms, or even cause systemic lupus flares throughout the body. Lupus photosensitivity can cause rashes, fatigue, joint pain, or fever after sun exposure, even through windows or indoor lights. Symptoms may appear within hours or days and can be triggered by even brief UV exposure. For those with lupus, just 15 minutes in the sun can lead to a flare-up. In lupus, UV light damages cells, releasing contents the immune system wrongly attacks, causing inflammation. This leads to skin rashes or widespread organ issues. Both UVA and UVB rays are harmful. UVA penetrates deeper and can even affect you through windows or while driving. Photosensitivity in lupus can trigger skin reactions, from mild redness to severe rashes on sun-exposed areas. It can also worsen symptoms like fatigue, joint pain, and fever, aiding in diagnosis. If your skin reacts oddly to the sun or you feel unwell after being outdoors, take it seriously. Track your sun exposure and note any symptoms like rashes, fatigue, or joint pain. Dermatologists can perform photosensitivity testing to confirm abnormal UV light reactions. Combined with clinical exams and blood tests, it helps diagnose lupus and guide sun protection strategies. Early recognition of photosensitivity helps prevent flares and skin damage. Use broad-spectrum sunscreen, protective clothing, wide-brimmed hats, and avoid peak sun hours to stay healthy and comfortable. 7. Persistent mouth sores. Mouth sores, also called oral ulcers, occur in approximately 25 to 45% of people with lupus and can be an early warning sign that's often overlooked or attributed to stress, minor injuries, or nutritional deficiencies. These aren't typical canker sores that heal quickly. Lupus-related mouth sores tend to be more persistent, recurrent, and may appear in patterns that distinguish them from common oral problems. Mouth sores, or oral ulcers, affect 25 to 45% of people with lupus and can be an early, often overlooked sign. Unlike typical canker sores, they are more persistent, recur often, and may have distinct patterns. Lupus mouth sores can appear anywhere in the mouth, including the lips, gums, tongue, cheeks, and roof. They look like small ulcers with white or yellow centers and red edges. Unlike regular canker sores, they may last for weeks or months and are often painless, which makes them more concerning and worth checking with a doctor. Lupus mouth ulcers often appear in clusters and may come and go with disease flares. They result from autoimmune inflammation, where the immune system attacks healthy tissue in the mouth and sometimes the nose, causing painful sores. Lupus mouth sores can make eating, drinking, and speaking painful, especially near the tongue or teeth. They may cause sensitivity to spicy or acidic foods and make oral care difficult, increasing the risk of further dental issues. Document mouth sores with photos, noting their location, size, duration, and any links to triggers like stress, food, or hormones. Early recognition and treatment of lupus mouth sores can ease symptoms and prevent worsening. Options include topical meds, lupus therapies, and oral care to promote healing and prevent infection. 8. Chest pain and breathing difficulties. Chest pain and breathing difficulties in lupus can be alarming symptoms that often prompt emergency room visits, but many people don't realize these symptoms can be early signs of the condition. The chest pain associated with lupus typically results from pleurisy, inflammation of the pleura, the thin membranes that line the lungs and chest cavity. This type of pain has distinctive characteristics that can help identify it as potentially lupus-related. Pleuritic chest pain from lupus is sharp and stabbing, often on one side of the chest. It worsens with deep breaths, coughing, sneezing, or certain movements. The pain can be sudden and range from mild to severe, sometimes feeling like something is tearing inside the chest. This makes it hard to breathe deeply and helps distinguish it from heart-related pain. Lupus can affect the heart, causing pericarditis, an inflammation of the heart's lining. It leads to chest pain that worsens when lying down and improves when sitting up, often mistaken for pleurisy. Chest pain with breathing difficulty needs urgent medical attention to rule out serious issues. If it feels like pleurisy and you have other lupus symptoms, tell your doctor. Lupus-related chest symptoms are diagnosed using chest X-rays, CT scans, or ultrasounds, along with blood tests for inflammation and lupus-specific antibodies. Early recognition and treatment of lupus-related chest symptoms can provide significant relief and prevent complications. 9. Dry eyes. Dry eyes might seem like a minor inconvenience, but when they occur in the context of lupus, they can signal a significant complication called secondary Sjogren's syndrome. This condition affects approximately 15 to 20% of people with lupus and involves the immune system attacking the glands that produce tears and saliva, leading to persistent dryness that goes far beyond occasional eye irritation. Dry eyes from lupus or Sjogren's syndrome feel more severe than typical dryness from air conditioning or screen use. People often describe a gritty, burning, or stinging sensation, especially in dry or windy conditions. It's not just fewer tears, tear quality also changes, lacking the right mix of water, oils, and proteins. This leads to irritation, rubbing, and more inflammation. Dry eyes can make daily tasks like reading, computer work, and driving uncomfortable. Symptoms often worsen in air-conditioned spaces, on planes, or in windy areas, affecting work and quality of life. Many with lupus and secondary Sjogren's syndrome also have dry mouth, causing trouble swallowing, taste changes, dental issues, and frequent infections. This combination is a key sign of Sjogren's syndrome. Diagnosing dry eyes linked to lupus involves more than symptom checks. Eye doctors use tests like the Schirmer test to measure tear production and assess tear quality and corneal health. If you have persistent dry eyes, especially with dry mouth and lupus symptoms like fatigue or joint pain, don't ignore it. It could be a key sign of something more serious. Early detection and treatment of lupus-related dry eyes can prevent corneal damage and boost comfort. Options include artificial tears, prescription meds to boost tear production, and procedures to retain tears. Managing dry eyes in lupus involves eye care, environmental changes, and sometimes systemic treatment. Early treatment helps protect eye health and comfort. 10. Raynaud's phenomenon. Color changes in fingers and toes. Raynaud's phenomenon affects 30 to 40% of people with lupus, causing fingers and toes to change color in response to cold or stress. It's more than just cold hands. It's a visible, early sign marked by dramatic color changes. Raynaud's attacks follow a tricolor change. Fingers turn white from reduced blood flow, then blue from lack of oxygen, and finally red as circulation returns, often with throbbing or tingling. Triggers include mild cold, like holding a cold drink or air conditioning, and emotional stress, making the condition unpredictable and sometimes embarrassing. Raynaud's attacks can last for minutes to hours and cause numbness, tingling, pain, and loss of fine motor skills, making simple tasks difficult. In lupus, Raynaud's is more serious as it may affect not just fingers and toes but also the nose, ears, lips, and even internal organs due to poor blood flow, leading to possible complications. In lupus patients, Raynaud's phenomenon is common due to immune system attacks on blood vessels, causing them to overreact to cold or stress. Repeated attacks can lead to painful finger or toe ulcers, slow healing, and in rare cases, tissue damage or death. It's important to distinguish between primary Raynaud's, which occurs alone, and secondary Raynaud's, which is linked to autoimmune diseases like lupus. Secondary Raynaud's is usually more severe, appears later, and includes other symptoms. Raynaud's phenomenon is assessed through clinical observation, cold challenge tests, and nail fold capillaroscopy. Blood tests help identify if it's primary or linked to an autoimmune disease like lupus. Early recognition and proper management of Raynaud's phenomenon can prevent complications and significantly improve quality of life. If you found this video helpful, don't forget to like, share, and subscribe with notifications turned on for more health tips.